नमस्कार, मैं हूं अशोक व्यास और आज हमारे साथ हैं एक ऐसे सज्जन जिनके पास जाने से दर्द कम हो जाता है या वो इस तरह से हमारी मदद करते हैं कि वो सारा दर्द जो हमारे शरीर के कई अंगों में उतर गया है वो उसको उतार कर दूर कर देते हैं। बात है फिज़िकल थेरेपी की। और फिज़िकल थेरेपी किस तरह से जो शरीर में पेन होते हैं, कभी कभी गर्दन दुखने लग जाती है, उसको कैसे वो ठीक कर सकते हैं, इसके बारे में ख़ास करके आज हम बात करेंगे। और डॉक्टर नीलेश सोनी के साथ एक ख़ास बात यह है कि वो 18 सालों से सेवा में सक्रिय तो रहे ही हैं, and at the same time he loves to increase awareness of people about how they can work with their body in such a way that they stay away from pain. But let us move near Dr. Nilesh Soni. Welcome, Dr. To our studio. And allow me to ask you, do you see any correlationship between stress and pain in the body? For example, I smile, but somewhere I am also worrying and thinking as to what terrorists are doing in Mumbai. We just got this news 2 days ago. A lot of people get killed. इस तरह की जो खबरें आती हैं वो आदमी उनके बारे में सोचता रहता है, क्या उससे भी कुछ जो पेन ऑलरेडी है वो बढ़ जाता है या पेन हो सकता है?
Definitely, stress does have a physical manifestation. That's why there is a big emphasis on being aware of the stress and how to cope with it and how to avoid having stress. Now, there are so many stressors in life, as we were just discussing the news of bomb blast in Bombay. But then besides that, there are other types of physical stress or work-related stress, relationship stress. So all of these things does have physical manifestations if they exist for a long period of time. And that's why sometimes people say he's a pain in the neck. And when we say pain in the neck, it does, if you perceive something or some person as a stressor, then the muscles, certain muscles of your body gets tight. Just say the nape of your neck or the muscles originating from the base of your skull and coming to the tip of your shoulders, they get tight. And that can restrict your neck movements, that can affect your posture, and it can lead to pain. And that's why I'm here today to discuss a little more about neck pain.
And before we talk about neck, I would like to take this opportunity of sharing one piece of good news for those of you who want to go to see a physical therapist, but they feel that there's nobody at home to take them there. So Dr. Nilesh Soni is providing this free transportation for those who want to go. But let us say, when do you consider a person should decide कि भाई अब मुझे फ्री ट्रांसपोर्टेशन की जरूरत है, या कुछ लोग सबवे में भी आ सकते हैं, बस में भी आ सकते हैं, बट देयर हैज टू बी सर्टेन टाइप ऑफ स्टेज वेयर यू कंसीडर कि भाई
let me expand a little on it. It's a courtesy transportation, so first of all you should be able to walk to the car and get in and out of the car. So if you are capable of doing that physically, you can use that service. It's a courtesy service. There is no sort of eligibility for it. Once you are coming to our clinics for physical therapy treatment, you can use that transportation for the first visit or your ongoing visits or for evaluations too. So the only criteria to get this service is that you should be able to physically get in and out of the car. So there is no sort of medical transportation where you have an ambulatory or ambulance. This is the regular car service which brings you to the clinic as a courtesy to our patients.
And the basic question when we hear about physical therapist, we think that maybe a capsule or a tablet is going to help me. And what is it? How would I distinguish that now I need physical therapist or just a tablet is fine?
Let's focus on neck pain. If your pain is, if your aches are keeping you awake at night and you have the neck pain for more than 2 weeks, and routine measures of rest and taking hot water shower or taking over-the-counter pain meds are not helping, or you're getting tingling or some strange sensations in your hand, or you're having progressive weakness in your hand. those are all the indications that you need serious help. And physical therapists are trained to evaluate your neck condition, and they can pinpoint what issues are occurring in the neck musculature or the spine, and provide you a treatment for such aches and
Let's go age-wise now, Nilesh ji. जैसे कि छोटे बच्चे होते हैं and they go to school and sometimes their bags are so heavy. And there are some kids, I mean not all, but there are some kids who loves to say कि मेरे यहाँ दर्द हो रहा है, मेरे वहाँ दर्द हो रहा है. And sometimes mother start wondering कि इसके गर्दन में दर्द हो रहा है, बहुत कहता रहता है. So at what point mother should take the complaint of kid more seriously than normal?
If the kid is not doing routine activities, see, some kids may get off from their work or homework or their school assignments by complaining of stomach ache, neck pain, all types of pain. But if a kid is routinely avoiding play activities, the things he or she enjoys, like playing video games, and the child is even leaving the video games because of stomach ache or neck pain, there's something wrong. The kid is not making up the story. Secondly, the activity patterns changes. The kid is usually, after coming to home from school, would like to play, say, basketball, or would like to do some play with the siblings. And you see the child not doing any physical activity, that's another indicator. So if the physical activity pattern changes for a consistent, in a consistent way, then that's an indicator to get some medical help, and not just say that the child is always complaining. And if the child does have pain and the child doesn't move that body part, say the child's neck is stiff, and you can literally see that the child is moving as a log, the whole, he or she is moving the whole body in the direction of the sound or the place he or she is attending to, then that's an indication that the child has problem.
There are very few of you who have never experienced pain in the neck. Actually, कोई ना कोई कारण से हो जाता है. Sometimes we feel कि कंप्यूटर के सामने ज़्यादा देर बैठे रहते हैं इसलिए हो गया है. Sometimes we feel कि ये सोने में कुछ ऐसा हो गया होगा. But वो recurring रहता है, तो it's very difficult to pass through that period जबकि दर्द हो रहा है. आपके हिसाब से what are the reason which leads to the stage where you have to have this pain?
A lot of people have neck pain. As we were saying, stress can be one reason. The other one is posture at work, especially for people who are sitting too long. So bringing your head forward excessively or bringing your head backward excessively or not allowing it proper can lead to pain. Sleeping, if you are sleeping on your stomach and you're rotating your neck on one side, so you have you are at risk of getting neck ache. Or people like to sleep while sitting, like somebody's traveling by train, and the commute is say 1 hour, and they doze off in the train, and the neck is getting those jaws as the train stops and starts, and while they are sleeping, that can lead to neck pain. The way you lift small objects at work or at home, that can affect. And of course, if you're doing heavy lifting, you're into say you're in a grocery, you're working in a deli and lifting cases of sodas or other supplies, and you're not looking at what you're lifting or not facing of what you're lifting, then it can also lead to neck pain.
अब पेन अगर हो गया है तो इच्छा होती है कि दूर हो जाए, तो दूर करने के लिए क्या क्या कर सकते हैं? So there are few things that any person can do for himself or herself.
Sure. The routine household measures will be, if it is acute pain because of an injury, like you pulled your neck while lifting something or while pulling something, then for the first 2 days you can apply ice pack or cold pack, and followed by some heat in form of hot water showers or hot water towels or hot packs, which are readily available in any drugstore. If that doesn't help you, there are over-the-counter pain meds, or you can consult your physician to get over-the-counter pain meds. And if those things fail, then you can approach physical therapy. Physical therapist, if you approach the therapist straight away without calling your doctor, then the therapist can assess and take medical help if needed. Otherwise, can help you address the problem through many modalities. For example, we have something called spinal decompression therapy, Now, the thing what the machine you're seeing on your screen can be used for any part of the spine. It can be used for your lower back pain, and it can be used for your neck pain. What happens that if there is excessive pressure on your spinal structures, and that is leading to pain and weakness in your body, then this sort of device can help.
I know we should have some visuals to explain how this works, but if you just talk to us about that, that just look like some
like a table.
Table, yeah.
That's a table with a computerized device attached to it, and a patient is laying on it, fully clothed, comfortable, and with the help of a harness which is going around their waist or around their neck, there is say periodic distraction or pulling of their neck to cause decompression. That will lead to pain relief. Now, not all patients will go up on such a machine, but this is one of the advanced equipments we have that can be used to relieve neck pain.
Decompression word को थोड़ा simplify करें अगर
pressure caused because of any pathology. When you have any problem with the spine, the muscles surrounding the spine go into protective spasm, or they become tight to protect that affected area of your spine. And if they become too tight, they cause undue pressure on the spinal structures, leading to pain and weakness. So by using such machine, that the muscles are lengthened, the pressure on the spine is relieved, leading to decompression. So the word decompression.
So going back, and maybe there's slight repetition there, but we want to be careful about the prevention. As the saying goes, prevention is better than cure. You may not like it, but the preventive way में क्या ऐसा है जो neck के point of view से we should be careful about?
A few things. One is analyze the work posture you are. If you people will tell you that you are always stooping forward, or you're moving your neck forward. You'll get this feedback from your family members. If you are acutely aware of your posture, good, you can make an attempt to correct it. Otherwise, get a feedback from your friends and family. And if that is still not sufficient, you can come for a visit to any therapist to do a postural assessment. That is the first step. The second thing is get into routine exercises. I would say activities instead of exercises, like moving your neck. Now, I can suggest certain things. Like if you are getting a feeling of tightness in the neck, you might be benefiting by just moving, shrugging your shoulders backwards, or rolling your neck side to side, or stretching your neck on each side with your hand, or with someone else's help. So doing simple activities or exercises can help you prevent build up stress around your neck. If those things are, you're doing those things and still you get pain, then get help from a professional.
And people are scared of actually calling anybody other than their friends. Normally, वो कहते हैं यार ये ऐसा हो रहा है क्या करूँ, कहते हैं ये घूम के आ जा, वो कहते हैं, then they feel good. But when it's a matter of approaching any professional, then many of the people who come from India, they are reluctant. दो बातों के लिए. एक तो it takes time to build a sense of trust. They don't want to spend as long as possible. तो दोनों पॉइंट ऑफ व्यू से तो बात नहीं कर सकते हैं. ट्रस्ट के पॉइंट ऑफ व्यू से आप कहेंगे 18 साल से यू हैव बीन देयर. सेकंड जो बात है, people are not sure whether the insurance, medical insurance, is applicable for physical therapy also.
We accept most of the insurances, and physical therapy treatment is covered by such insurances. The second thing is, as far as gaining confidence and understanding our patients, we speak almost all, we speak Hindi, Gujarati, Punjabi, Urdu, little Marathi, understanding Marathi more than speaking Marathi. So people from different parts of India can come and can relate their medical issues in their own language and still get satisfactory answer from the staff. Secondly, we have advanced gadgets which can be used to deal with any complex neck problem. And last thing is, if we are experienced enough that if we think that this problem cannot be resolved by us, then we can direct the patient in the right direction to a specialist, to your neurologist, or to any other medical professional we need to.
Now, talking gender-wise, the kind of role responsibilities which a man have and a women have are still a little bit different. Let us talk about the traditional way. If women is very actively working in kitchen, and she has to lift things from here, there, etc. That also sometimes results into back ache
Neck
or
pain.
neck pain also.
Yes, but it can happen to both. It can happen to females as well as males. Neck problems, I can classify them in a few categories. One is simple sprains and strains. So that happens by a quick movement of your neck or by a sudden jolt. The second one is because of degenerative changes in the joints of your spine, or we say hypertrophy of your spinal joints. Now, if that happens, then it involves a long course, means it's going on for a long time, and it happens for people in the age group of 40 to 60 or 40 to 70. And the third one is injury. If somebody is in a car crash or somebody's car get hit from the back, they get a sudden whiplash. And that leads to injuries mostly to the ligaments or the elastic strings which support the spine. The last one is something with the disc or the gel-like structure in between the spine, and if there are degenerative changes, there can be disc bulging or disc prolapse, which leads to weakness in the muscles as well as pain which comes down radiating to either arm or both arms in some cases, and sort of we call it cervical radiculopathy. But in short, patient gets pain, weakness, not only in the neck, in the nape of the neck as well as both upper extremities. So these are some types of neck pains, and from the mildest to the most severe spectrum, physical therapy can help to resolve the problems without the use of medicines.
Without the use of medicine, जब सुनते हैं कि physical therapy से ठीक हो सकते हैं, you are reading these words free transportation in Queens, क्योंकि डॉक्टर नीलेश सोनी जी जो हैं वो फिजिकल थेरेपी की हेल्प के लिए अगर उनके पास जाना है तो चाहे existing patients या नए patients कोई भी ये help ले सकते हैं?
Yes, yes. It's available for all patients who have been to us in past or who are planning to come to us. So it can be used for all types of patients. And I wanted to mention one more thing. We have something called laser therapy, which we've been using, and we've been successful in treating pain, especially any muscular aches. Like if you have tendinitis, if you have spasms, then such treatment of low-level laser helps. It's painless. You don't even feel what's going on except hearing a beep. And between 6 and 8 sessions, you get significant relief in pain by such treatment.
This picture in itself looks beautiful actually. But this white beam like thing which is flowing downwards, what is that?
It's just a schematic of laser, low-level laser entering your tissues, and how it it propagates into the body. Basically, it works on the principle of photobiostimulation. In simple words, with the light energy used at a certain wavelength, there are therapeutic effects leading to decrease in inflammation and pain into the affected areas.
ये जो बात आपने बताई उसको थोड़ा सा और समझने के point of view से, you said light is
light
used,
photobiostimulation. So basically, the laser energy is helping to do two things: to heal the painful structures, and secondly, relieve the inflammation. That's what the latest research is saying. In simple words, it's a painless treatment, and it is done topically, means you apply that applicator to the patient's skin, and thirdly, it doesn't involve any invasive procedure to it.
तो ये neck के pain के लिए भी laser
related. So if you have neck pain because of some muscle strain or tendinitis into the neck and shoulder musculature, it can be used.
Right. And there are no side effects of this?
Yes, we have to be careful where we apply laser. You'll be if somebody is being treated with laser, you have to wear special protective eyewears or glasses to avoid exposure to eyes or open areas. But again, those are common sense steps which any clinician will take to avoid accidental exposure to eyes. But other than that, there are no side effects to it.
सो पेनलेस ट्रीटमेंट लेज़र के थ्रू अगर किसी तरह का पेन है तो उसके लिए फिजिकल थेरेपी में अवेलेबल है और डॉक्टर नीलेश सोनी उस बारे में भी मदद कर सकते हैं। डॉक्टर साहब, जो पेशेंट्स आते हैं आपके पास में, अगर नेक पेन से रिलेटेड पेशेंट्स को आप याद करें तो क्या कोई पर्टिकुलर एवरेज पीरियड होता है कि भाई बहुत ज़्यादा दर्द था तो इतनी बार आने के बाद
कम हुआ? Usual length of physical therapy treatments for neck pain varies from 6 treatments to 18 treatments. So if somebody is having minor aches and postural deviation, means they are not sitting the right way or moving the right way, those problems can be resolved by 6 treatment sessions. If the patient is having say weakness and pain radiating down their arms and other limitations of movements to their neck, they may well end up with us for about 16 to 18 sessions. That's a big commitment on the part of the patients to come to us on a consistent basis. But if they do so, then there are results, significant improvements in their strength, in their movements, in their ability to work pain-free.
एंड नीलेश जी, जो फ्रीक्वेंसी रहती है, जैसे एक बार गए एंड देन मुझे जैसे वो लेज़र वाला अच्छा लगा, समझिए कि लेज़र ट्रीटमेंट लिया उन्होंने एक बार, then they are supposed to come back after a week or after a month, or how that works?
There are frequencies, and again, before I tell the frequencies, we don't do one modality. Like I will not just do spinal decompression and not do my routine exercises. It's a combination of exercises, stretching, use of pain relieving modalities, use of such decompression therapy, that all of those things in total will help you. Patient doesn't come in just for laser treatment, but along with laser you may have core strengthening exercises, you have postural correction exercises, you may have other pain modalities we use. So it's a part of the treatment. Whatever we just discussed are parts of the treatment. The whole treatment takes longer and it includes more modalities. And as far as the frequency is concerned, you can come for physical therapy as little as once a week or as more as 5 times a week. But the routine frequency is between 2 to 3 times a week.
तो बात हम कर रहे हैं दर्द हटाने की, पर दर्द के बिना भी मज़ा नहीं आता है। दर्द कई बार ऐसा होता है कि हम खुद उसको बुलाते हैं, because we indulge in certain activities which result into some byproduct like gift for us in our body. इस रेफरेंस में ख़ास करके जब फेस्टिवल्स आते हैं, थैंक्सगिविंग वीकेंड हुआ, कुछ लोग हैं जो टर्की, लेकिन नॉन वेजिटेरियन लोग भी सोचते हैं कि आई हैव टू सॉर्ट ऑफ कंपनसेट, क्योंकि बाकी लोग बहुत कुछ खा रहे हैं। The point, Dr. Nilesh, is people allow themselves to eat more than what they normally do, and that also results in some sort of physical symptoms. तो कभी-कभी पेन भी उस कारण हो सकता है क्या?
Well, not the neck pain. You can have increased weight leading to back pain, but indirectly related. If you, in the holiday seasons is the time I feel that we should all give ourselves a break. Everybody here in United States is health conscious and we are diet conscious and we are on the crusade of reducing weight. But surprisingly, during holidays I feel differently, like Diwali or Thanksgiving or people who are celebrating Christmas. Those are the times you should give yourself a break to enjoy a little, because if we just do dieting even in the holidays, then you're not really enjoying the sense of festivity which is going around in your home or within your families. But a common sense tip I would want to share is enjoy for that day. Just don't continue enjoying from then onwards. Say, okay, the whole winter I'll be in the festive mood. So yes, coming back to your question, can dietary habits affect our body physically? Yes, on a long run, if we are not careful, it can lead to physical symptoms because of weight gain.
And what happens is we always look for कि ऐसा क्या जो फ्री में मिल रहा है. in fact, nothing comes for free because your attention is there and that is most precious. So let us pay attention to what Dr. Nilesh has to say about some tips which you may again repeat for those who join us a little late, that may help us in staying away from neck pain.
Sure. Watch your posture. If you need some postural advice, go to a physical therapist. Do simple exercises. Watch your work environment, analyze your work environment, especially if you're doing a sitting job or whether you are doing some kitchen work, and find out movements which leads to such neck pain or neck ache, and you can work with a therapist to sort of avoid those and learn the right movements.
And talking about the right moment, the moment has come where we'll be saying thanks to Dr. Nilesh Soni for sparing his time, coming to us with this wonderful news that in case you have pain and you need help from a physical therapist like him, no, not like him, from him, then he has a way to provide free transportation if you are in Queens. So not for Connecticut or New Jersey, not for Long Island, only Queens.
Queens.
Do you love Queens so much that you are giving only in Queens?
I have my offices located in Queens, and I think I should start which is the closest proximity to the office. The patients can benefit right away, and we'll see what we can do in future.
So we'll definitely see what we can do in future, but what we can think right now is that the way you live, that is the kind of experiences you have, especially talking about your physical health and well-being. You have to watch how you move, how you lift things and all those things which are simple and very important. And talking about these simple and important things, we had Dr. Nilesh Soni with us. Dr. Sahab, thank you very much for
It's always a pleasure.
studios.
Thank you.
This is Ashok Vyas wishing you a great week ahead. Thanks for joining us.